Hello everyone, my name is Stella Obasanjo and I'm a high school senior currently doing an externship with the Greenberg Town Hall. For my project, I focused on healthcare inequities and disparities and how people in certain communities experience access to care. In order to analyze this problem, I created a short community survey to hear directly from people about their experiences with healthcare, things like access, affordability, and treatment experiences. But before I talk about the survey results, I want to explain what healthcare inequities actually are and why they matter. So, healthcare inequities refer to unfair and avoidable differences in healthcare access, quality, and outcomes. And these include, but are not limited to, access to care, like appointments, doctors, transportation, cost barriers, like insurance, prescriptions, and treatment costs, mental health access, racial and cultural disparities, specifically racial and implicit bias, geographic differences, and health literacy, which just means understanding medical information. And these issues often overlap. For example, someone might have insurance but still avoid getting care because of high costs or difficulty getting appointments. And so now that everyone has a better understanding of what health inequities are, I'll introduce the survey I conducted and what it was designed to explore. And the questions focused a lot on things like access to care, affordability, and experiences with healthcare providers, so like patient-provider relationships. And because this is a very small sample size, I was only able to get 7 to 8 respondents of the survey. I'm not going to be using percentages or statistical conclusions. Instead, I'm just going to be focusing on themes that appear across responses. And so all of my survey respondents have worked in healthcare for at least 6 years. 2 respondents have worked over 20 years. And they also all stated that healthcare disparities are very significant within their community and or workplace. So starting off, one major theme I noticed was the cost of healthcare. Even a small number of responses highlighted how costs can affect whether or not people seek care. In a specific question I asked, what do you think is the biggest contributor to healthcare disparities in the United States? The majority of responses noted that lack of insurance or insurance costs, or insurance status, and rising costs are major contributors. And there's this quote that a respondent stated in a long response. They said, "A healthy society is a wealthy society." And I think that statement is definitely true to this whole issue of unequal insurance status between patients, because it really connects to the larger issue in the U.S. where mainly uninsured, but at times even insured individuals can delay care due to high deductibles or prescription costs, showing that basically the more money you have readily available to spend on healthcare, the more easily accessible healthcare will be to you. Because if you don't have that money readily available, then providers will simply not be able to give you the care that you need because the costs are rising at such an extreme level. So if you don't have that money, then you unfortunately won't be able to have that care. And if you don't have the insurance, then you won't be able at all. I think it's worse if you don't have the insurance, but for sure if you don't have like the money out of pocket, it's definitely a big problem. And then responses also show that changes in funding and public assistance programs heavily impact access to care for underserved populations as well. And so moving on, another theme that I observed was people like patient-provider relationships, so how people feel when interacting with healthcare providers. Certain responses reflect experiences where people did not feel fully heard or understood by their doctors. For example, in a TED Talk that I watched by public health expert Dr. Lisa Fitzpatrick, she describes a man who had been dealing with a health problem for years, but was not following through with medical care whatsoever. When she spoke to him, the issue wasn't simply that he didn't care about his health. It was that he felt disconnected from his doctor because of the way that the doctor was speaking to him and communicating with him. He stated that the doctor's language felt condescending and confusing to the patient, and he felt as though he wasn't being respected. So then as a result, he hadn't seen a healthcare provider in 10 years after his initial visit. And what started off as a small health issue turned into a very big one, as he was later diagnosed with type 2 diabetes once he returned after those 10 years had passed since his initial visit, which is obviously a really big issue and raises important questions about communication, trust, and patient-provider relationship. And in a specific question I asked in the survey, when I asked how significant do you think, or what, do you think that fear or mistrust of the healthcare system or communication issues deter patients from seeking care, I got responses that reflect very significant amounts of healthcare providers thinking this because of circumstances and experiences like this. And so lastly, another theme that I was able to observe was education. So underserved populations who are not educated enough about healthcare will often have a fear, like I just mentioned, a fear or mistrust of the healthcare system. So this is very similar to the theme that I just discussed, but speaking about mainly how the system is at fault, because people will have their own opinions, but usually it's not being helped by the system. So they will often seek care, they will often be reluctant to seek care even when they need it the most. So these things deeply affect the care that they receive. And then language barriers also exist, which prevent individuals with limited English proficiency from understanding what the provider is trying to tell them. And so now moving on to solutions, this project is not only about identifying challenges, but also thinking about solutions. And so some solutions that could hopefully help these individuals in the future are things like expanded telemedicine, which is the broadened delivery of healthcare services remotely via digital communication tools, improving healthcare access, a nationalized healthcare system where the government funds care through taxation, universal insurance, expanding mental health resources, improving communication skills in healthcare settings, increasing awareness of local resources that are available to patients, and finally, training doctors in their communication skills and just making sure that they know exactly how to speak to these patients and make sure that they understand what's being told to them. Because like I mentioned, education plays a really huge role in this. If they don't know what they're being told, and this also relates to health literacy, which is just understanding health information. If they don't understand what they're being told about their health, then they may not choose not to seek care because they don't know exactly what's wrong with them. So just really making sure that these patients are aware of the resources that are available to them and making sure that they understand what they're being told is really how we can fix these health inequity and health disparity problems. And this project has really shown me that listening to people's experiences is essential to understanding healthcare inequities. And so on that note, I would like to end with a question to the audience. What changes do you think would make healthcare more accessible in your community based on what you or people that are close to you have experienced? I want the audience to really think deeply about this question because this project has really opened my eyes to new problems and issues that are still looking for solutions. And these issues have been debated for decades at this point. So hopefully if we can all, my belief is that if we can all work together to really combat this problem, then within the next couple of years, healthcare inequities and healthcare disparities can really start to go down in frequency, and patients can start to receive the care that they need without any issues. Thank you for listening.